So today we are going to discuss the mood or affective disorders, which are important psychiatric disorders frequently encountered. The three major mood disorders include MDD or major depressive disorder, which is prevalent in 5% of the population. Although minor forms or milder forms of depression can be seen in up to 15 to 20% of the population. Then is secondary depression, which is secondary to some medical illness, chronic alcoholism, or other substance abuse. The bipolar disorders, which are seen in 1 to 2% of population, they are also frequently encountered, and bipolar means two poles. Sometimes the patient is maniac, sometimes the patient is depressed. Bipolar disorder, other name for this is manic depressive psychosis. The major depressive disorder is differentiated from bipolar disorder by the absence of maniac attack. Now mania has already been discussed. Today we will concentrate on the depression or depressive disorders. What are the risk factors? Female sex is a very important risk factor for the development of depression. It is more common in women in contrast to mania, which is more frequently encountered in males. Genetic factors play a role as the incidence is 2 to 3 folds higher in the offspring of parents who have history of depression. So genetic factors play a role. Then non-genetic factors, common stress, emotional trauma, central viral infections, and some developmental abnormalities of brain, they have also been blamed. Damage to CNS, stress-induced damage in the limbic part is implicated in some theories. Raised levels of corticosteroids secondary to raised corticotrophin releasing factor, they are implicated in the causation. Now this is the most important theory which we use in developing the drugs. Deficit of amines, norepinephrine or 5-HT or both in some parts of the brain is responsible for causation of depressive symptoms. So we will try to use the drugs that raise the levels of norepinephrine or 5-HT in the synapse. Now, as I told you, some medical illnesses, cardiovascular diseases, HIV, malignant diseases, some chronic diseases, autoimmune, they are commonly associated with some degree of depression, or depression can be secondary to substance abuse, opioids, narcotics, alcoholism, etc. Then negative life events, they can precipitate depression. This is known as reactionary depression. Death of a near one, assault, violence, such sort of things which can precipitate depression. So how the patient presents. These are the 9 symptoms commonly seen in a depressed patient. Patient himself can report, or the family members or the attendant report that mood is depressed for most of the time during the day. There is reduced interest in pleasure or almost all the activities, significant gain or loss of weight, significant increase or decrease in the appetite, lack of sleep, insomnia or hypersomnia occurs almost every day, psychomotor agitation or retardation, Patient feels energy, A for absent. Energy is absent. Energy is feeling loss of energy or fatigue almost every day. Feeling of guiltiness or worthlessness, decreased ability to think, decide, or concentrate. And there are thoughts of death or suicidal ideation, or in severe cases, there may be history of suicidal attempt in the past.